Hey there, and welcome. I'm Anna Hartman, and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs and the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hello. Welcome to another episode of the Unreal Results podcast. Coming at you from Florence, Italy, of all places. I am currently on the road with one of my track and field athletes, and he's over in Europe doing some Diamond League meets. So here we are, first time in Italy. It was beautiful. I walked around today, and I had just a great walk, exploring everything and seeing Florence. So now I am sitting down to record the podcast, a little bit late, but better late than never. And then I'm about 30 or 40 minutes or so before the first call of the Revitalize Mentorship program for this year. So super excited to welcome the new people into the program. So busy day here in Florence, despite maybe what my Instagram seems like, because people are asking if I'm on vacation. Not on vacation, but did have time for about an hour and 40-minute walk today. So we left off last week talking about lessons from my back surgery. So my back surgery was in 2009. It was right before I turned 29, about a month before I turned 29. And it was a tipping point, a big tipping point in my professional career of just learning other things than mainstream movement-driven performance physical therapy and athletic training. And so like looking back on this journey, it was such an important part of my life and my growth as a professional, but it was very challenging in itself too. So I mentioned on the last podcast about the story leading up to the surgery, which is a little bit comical, but then I also talked about how it forced me for the first time to really learn how to make changes in the body more from a movement side than a hands-on side. And this is a really important part of the journey. While I was doing rehab, I decided I was smart enough to realize that since obviously the people I worked with, I trusted a lot in terms of physical therapy and rehab. However, I did not trust myself enough to know that if I scheduled appointments with them for my rehab, that I would actually show up and do it, and also be left alone by all of the other people, the employees, coworkers, and athletes there during my treatment time. I was smart enough to realize that if I was doing treatment in the place that I worked, I would probably still be working on the business as opposed to being focused on myself. And I wanted to give myself the gift of stepping away from work so that I could just focus on me and my own body in my rehab. And this in itself is an important lesson because it does take a lot of focus and intention, and you have to be like fully in and fully with your body. This is when I work with my athletes, why I'm not a big fan of them grabbing their phone when I'm working on them. Sometimes I'm all right with it depending on what I do, but for the most part, if they're working with me, they're locked in and they're working, we're working together. I'm working with their body, not on their body, and it's a little bit of a dance, and I need them paying attention and having the intention that we're in a healing and like improving the body, getting to know the body phase. So with that said, since I was going to be paying for rehab, I wanted to make sure that my money was well spent in terms of not just finding a physical therapist that I trusted, but finding a physical therapist that could teach me something that I didn't know. So I wanted to go somewhere that was a little bit out of the traditional realm of physical therapy for post back surgery. And I found a Pilates-based rehabilitation practitioner not too far away that came well recommended. And her name is Heather Brummett. Shout out, Heather. She owns Balance Pilates and Physical Therapy in Glendale, Arizona. And she is a Pulsar Pilates trained movement practitioner. And so I was like, this is perfect. Not only will I get to work on my own body, but I'll get to learn about how to use Pilates in a rehab setting. And this was a super important step for me. The gift of this, and specifically why I chose a Polestar Pilates practitioner, whether I really knew it at the time or not, the benefit of choosing a Polestar Pilates practitioner is that they're the training they have is one of the most comprehensive of all the Pilates programs, and it's really based on some foundational movement science. And that is really the way they teach Pilates, is more from a movement lens versus a Pilates lens. And so within that, I started learning a lot about moving my limbs in different ways, what it really means to connect into my fascial tensegrity, into my core, and really the initial gifts, because obviously this Pilates journey was a long time, both rehab, and then while doing my rehab, I decided to go ahead and do the certification to become a rehab trained Pulsar Pilates practitioner myself. And during the rehab initially, let's talk about that, keep this on task with the episode. One of the biggest things that we found was that when I wanted to create some stability around my core, my habit was to overly clench or squeeze the posterior pelvic floor, which I thought at the time was squeezing my glutes. I was really trying to bind down, create some stiffness in my pelvis. And this is probably from years of, well, this is two things. One, it's from years of doing gymnastics when I was a kid. The sway back posture that is very common in gymnastics and in young adolescent girls who are hypermobile like myself. And I say that with an asterisk. I don't have a hypermobility disorder, but I tend towards hypermobile. The tendency in the sway back is to shift your weight back on your heels, tuck your butt under, so you push your center of mass forward, because then your back is behind you. It's literally, if you can imagine a gymnast landing, right? Sticking their landing from the bars or the vault or whatever, and that big arch position they get in their back, their upper body is really far back, their pelvis is forward, kind of like a banana back. This was my default posture. And in this posture, it puts a lot of load on the lumbar spine, because it changes the position of the lumbar spine. Instead of being in a nice lordosis, it actually flattens it out, because that posterior weight shift and that clenching of the glutes tucks your pelvis under, posteriorly rotates you, and starts to reverse the curve of your lumbar spine. And so you get a flat lumbar spine, and then one typical pivot point up higher at the top of the pelvis, or even at the thoracolumbar junction that And that even drives some segmental instability there, which is more than likely that, in combination with a very high velocity car accident I was in when I was 16, is probably the initial insult that sort of destabilized and created a lot of that segmental instability in my spine anyways. So this is what we found in Pilates, that every time I needed to do something to connect into my like deep core, specifically the anterior part of my deep core, I just had a really hard time to, and I'd always try to clench and tuck my butt under. And the first thing here too was to even realize this standing position. I started noticing when I'd go back to work and I'd be standing in the PT area at Exos, I was like, oh my gosh, all of a sudden I was hyper aware of when I was just standing there, how often I locked my knees out, sent my weight to my heels, clenched my butt, pushed it forward to support myself. So one of the most important things I was trying to improve upon is keeping my body up on top of my legs, shifting my weight forward. And this, going back to sort of the fundamentals of movement, is this is our, well, you know, quote unquote good posture, but this is also, I was lacking a fundamental important piece of motor control, being controlling my center of mass, right? Having balance. The first strategy of losing your balance is to have an ankle sway, being able to sway forward or anterior weight shift on your feet. And I had totally lost that. And so improving that became sort of the goal, and improving my core stability, and getting out of the habit of using my legs, my pelvis, to cheat my core out of actually stabilizing. So we spent a lot of time with the Pilates equipment, which is a great environment to help me connect into my core, which I became better at, but it was still challenged, which will lead us into sort of another piece that I found. But I'm gonna well, I guess that is the next piece I found. So first it was bringing awareness to that pattern, while working as I got tired. I did notice towards the end of the day it would be harder to get out of that pattern. And then the next step was another key piece of why I had such a difficult time connecting into my core, even with the Pilates environment. It was still pretty challenging, and I had to use a lot of conscious control over it, which is not ideal. We would really like that to be reflexive, because thinking about turning a muscle on or thinking about stabilizing, you've already lost the battle, because life happens really fast and these things should be reflexive. And so I never really had thought about it, well, when I thought about it previously of like, why is this reflexively not happening? The thought was that something's wrong with my body. I'm broken, my back's fucked up. And so this just goes with the territory, like your, multifidi get shut down, and you lose your motor control a little bit. And it just takes a lot of repetitions of like turning things back on. And I didn't fully appreciate the need for increased stiffness and the need for looking at it more holistically of like, is there another reason, a deeper reason why perhaps specifically my anterior core didn't want to reflexively turn on? An example of this you might have used in the movement world before, when you're doing an exercise, let's say even in the FMS world, because a lot of us are familiar with Gray Cook's, functional movement screen and the corrective exercises from that. One of the corrective exercises, one of the things he pulls from RNT training, so reactive neuromuscular training, is to create a little core stiffness, he has you do like a pull down. Let's say you're doing the straight leg lowering and you want some core control. So you lay on the ground in front of a cable machine and then you do a pull down. And this pull down helps to engage the lats and the anterior core. So a little bit of posterior anterior core to get a little connection. Or let's say it's squeezing something between your knees for the adductor and deep frontal line connection. Or even if it's at your hands, you know, you have a small flexible ball and you're squeezing it to turn on. Even those sort of things, I still had a hard time getting my obliques, getting my transverse abdominis, getting my abdominal muscles to turn, right, for lack of a better way to say it, turn on, to create stiffness and contraction. And so what's interesting though, if I did something posterior, right, if I pulled a band apart, and I got my posterior sling system to turn on, that reflexively created better stiffness around my core container. And so that was cool. And that means a lot of the exercises I chose to do when I was doing core control stuff, I did some sort of, you know, pulling out a posterior thing to create some stiffness across my core. But I never really thought, like, is there a deeper reason why maybe I'm having such a hard time turning on my core? And then throughout, you know, so I started this process. So I had the back surgery in 2009. I started PT probably, the rehab-based PT probably, you know, 6 to 8 weeks later in the fall of 2009. And then probably in 2010, I think, is when I started doing Pilates, like going through the curriculum to become a rehab provider. I was still obviously doing the exercises for my own body, but then I was doing a lot of Pilates because in order to become certified, at least in the Polestar curriculum, you have to put a lot of hours of teaching as well as doing the work. So I was doing a lot of Pilates. And throughout this timeline, you know, 2010, 2011 is when I finally, 2011, October 2011 is when I passed the exam to be a Polestar Pilates practitioner. And ironically enough, just 2 weeks before that, I had a flare up in my back. I had traveled to Japan to teach a group of professionals in Japan, and I remember standing in line for customs, and I was like, oh my gosh, I can feel my foot drop happening again. And it was just like devastating because I was like, here I am, like almost 2 years post surgery, and I've done all this rehab, like and arguably like one of the strongest like cores. Like I remember my colleague Sue Falsoni saying that. She's like, Anna, I just don't understand it, because she's like, your core control is better than so many people. It's like, what is going on, right? And I was like, yeah, but I knew then too. I was like, yeah, but even though my core control is good, it's only good when I'm like really thinking about connecting into it. And so there was still some sort of missing piece that I wasn't getting, because I would still have these flare-ups, you know. And this is too, like, this is just kind of the timeline with back sometimes. And especially I shared in the last episode, you know, like I had a microdiscectomy. It's not like anything was necessarily fixed. It was just we decompressed the nerve root that was getting compressed by the disc material, and that's it. And then, you know, I still had 2 other levels that were extruded that we didn't do. So it's not like I went in and like had a fusion and, like, you know, again, it's not fixed. It was just, the surgery was very helpful and a great outcome. But what you'll learn is basically, like, the best way to explain it is the transition from rehab, you know, is, you know, at first you pay attention and you count, or you recall how many days of the week, or how many even hours of the day that you felt good. And then it's like days of the week that you felt good. And then it's like how many days in the month. Then it's how many weeks in the month you felt good. And then pretty soon it transitions from remembering all the good days to then the good days become so frequent that then you're like, oh, I only had a flare up like, once or 2 times a week or once a month or every other month or every quarter. And so it was getting less and less, but that flare up in the fall of 2011 was a little frustrating because it was just like one of the worst ones, and I had to call and get a dose back, and it was frustrating to say the least. So anyways, I continued, in between I tried to return to some strength training to improve some stiffness and do some more like core based things. I remember doing like single arm bench press and single arm row and a lot of single arm stuff to try to get some, anti-rotation type of stiffening happening. All the things that we do and did at Exos that worked pretty well. And it never seemed to really shift anything. So anyways, life happens, and then that in 2011 was also when my mom was diagnosed with lung cancer. So then my focus even became less about my taking care of my own body and more about taking care of my mom. And honestly, it became like just getting through the day, just getting through life. Life got pretty difficult then. I was traveling back and forth to help her with her chemotherapy and, still working and all the things. So it took me a while, but, and I kind of continued on that path. I'd had flare-ups here and there. Overall felt good. I could control them. And when a flare-up happened with ibuprofen and some movement strategies I learned through Pilates, that was really helpful at taking my, doing some movement-based things to, segmental spine stuff and core stability things. It did really give me a good arsenal of movements and exercises that could get me out of a flare-up, which I continue to be very grateful for. But there was clearly something missing because even all those years of practicing and, like I said, being pretty strong in terms of what exercises I could do, I was still suffering from these bouts of segmental instability and flare-ups. So, in the end of 2013, after my mom passed away, I had finally signed up and taken my first visceral manipulation class. And that is the next big eye-opening piece. And what I realized I was missing all those years, because what happened was as soon as in lab we started working on the visceral organs, all of a sudden I was like, oh my gosh. Even just on the treatment table, I was like, holy cow, you did treatment on that area. And then I went to roll over and I felt for the first time in what felt like ages, which it was probably years, I felt my core reflexively turn on. And I was like, what? Like my anterior core. And I was like, what? And then it made so much sense with what I was learning, right? Because my anterior core especially was not turning on so well because I had a history of quite a bit of gut health issues going on at the time too. And I began to notice a correlation between when my eating was really clean and my gut was feeling better and my back feeling better. And then getting treatment, the visceral manipulation treatment, both in the classroom and then from my mentor, Veronica Campbell, after that. It was just, oh my gosh, clear as day what a role my viscera and my gut health was playing in my back, and specifically my ability to connect into my core control. And so adding this visceral manipulation piece in was a huge step forward in the struggle with my back. Then the next thing that actually came very soon right after that, right? Like I was like on this new plan with the visceral work and really figuring out how that all fit in, especially combining it with functional medicine type things too. And then I took a course with Philip Beach. And Philip Beach is an osteopath from New Zealand. You've probably heard me talk about him before. He's the author of the book Muscles and Meridians, The Manipulation of Shape. And when I learned from him, the first day actually of his course, he was teaching a 2-day course at one of the Pilates conferences that I was at. The first day, I was like, holy shit, this is what I'm missing. This is a piece. This is not only what I'm missing, this is what a lot of my clients are missing in their movement practice. And one of the things that he talked about was the need to introduce rock mats into your life and basically introduce an interesting life for your feet, and how the bottoms of the feet are neurologically, obviously the nerves that innervate the bottom of your feet come out of your lumbar, sacral plexus, and how sensing better in your feet is going to improve motor control of the lumbopelvic control. And it was like, oh, like mind-blowing for me. So I left the course that day and I went directly to Home Depot. I didn't go to home first. I went directly to Home Depot and I bought the rocks and I bought a bath mat and I bought Gorilla Glue and I sat down on the floor and I started making my own rock mat. And by the end of that weekend, I think that course was like on a Wednesday or Thursday, or it was either Wednesday, Thursday, or Thursday, Friday. By the end of the weekend, I had used the rock mat every day at that point. He recommends getting at least 30 minutes a day, cumulative, spending time on the rocks. And by the end of that weekend, I was no longer waking up with back pain, and my mind was blown. And not only was I no longer waking up with back pain, but I was also able to go down the stairs at my condo without any knee pain, which I was having some significant knee pain at the time too. And in the knee pain has like an origin. I have like a very large chondral defect, like patellofemoral chondral defect. So it's like I always had like very ice pick sharp pain going down the stairs. And so not only was my back feeling better, but my knee pain was gone with just 4 days of introducing the rock mats. And I was like, my mind was blown. And over the years, as the rock mats became like a big part of my practice and I've understood it even more, what I realized what was happening, and I would feel it in the mornings because they put the rock mat in my shower, is as soon as I stepped on the rocks, I would be forced to let go of the clench of the glute squeeze of the posterior pelvic floor, keeping me in that posterior tilt, keeping my sway back posture, the flat lumbar spine. As soon as I would step on them, within like 20 seconds, I would literally feel that relax and then shift forward on the rocks. And that's what the rocks sort of force you to do. The rocks, because of the mechanoreception of pressure from the rocks in your foot, the rocks help your body instantly find a new position to be in that spreads out the surface area, because more surface area means decreased pressure. And so it basically was a movement experience to create relaxation of the posterior pelvic floor, allow for a normal nutation of my counter nutation of my sacrum, widening of my sits bones, so I could find my anterior weight shift strategy, shift my whole center of mass forward, which then was easier to bring my rib cage up on top of it. And this was something that I knew was important too, that I've been working on and learning from with Elizabeth Larkham and some anatomy trains work. And it was just like a big piece that brought things together. And so not only did I add the rock mats into my life at that point, but I started adding in Philip Beach's erector sizes too, spending more time resting on the floor, more time getting up from the floor, improving my foot and ankle mobility, as well as my knee and hip mobility. And then that was a huge piece of going for way longer without back pain. And there's one more piece to this puzzle that I'm going to share about, and as well as probably more little tidbits, but I'm going to save that for next week. So Thank you for joining me for part 2 of the back surgery lessons, and I look forward to sharing more next week. Where will I be? I think I'll be in Paris next week, so we'll see where I film the podcast. But have a great day, and I'll talk to you soon.